In this lecture, we will discuss hypercalcemia, including potential causes and EKG features. Electrolyte disturbances can affect the normal cardiac action potential due to the changes in intracellular and extracellular ion concentrations. Some of the electrolyte disturbances may not have much of an effect on the EKG, while others may actually be life-threatening. In some cases, the EKG may be used to estimate the degree of electrolyte disturbance and risk of more severe arrhythmias. Just be aware that each individual electrolyte disturbance we discuss may also be associated with another electrolyte disturbance and therefore affect the EKG. Okay, so let's look at hypercalcemia. That is when serum calcium levels are too high. This often occurs in malignancies and primary hyperparathyroidism. Other causes include sarcoidosis, thyrotoxicosis, familial hypocalciuric hypercalcemia, Addison's disease, renal failure, medications such as tamoxifen, lithium, and diuretics, immobility, as well as from vitamin D or calcium overdoses. So what can we see on the EKG? Well, common EKG changes include a shortened QT interval, prolonged QRS interval, and bradycardia. Okay, so the most common ones and the ones I want you to focus on are these ones here. Okay, a decrease in the QT interval. Okay, so an increase in the QRS interval and bradycardia. So if you look here, what we're showing here is this is their calcium levels, okay? And we'll use this as we look at other changes in both potassium and calcium, but focus on this portion here. Because we're talking about hypercalcemia, we're looking at an increase in serum calcium levels. So we're going to be heading towards this direction, okay? And if it's heading towards this direction, imagine that our QT interval will shrink, okay? So it will be smaller, and that's what we have going on here. Now with our QRS interval, it tends to be a little different, okay? Now imagine our calcium levels now increasing. So because of this, our QRS interval will head that way, and our QRS interval will increase, okay? So just follow the positive, meaning an increase in calcium levels, meaning a shrinkage or shortening of the QT interval, and the other one are positive here in the QRS interval, causing an increase in our QRS duration, okay? Now, other rare EKG changes include an increase in the QRS amplitude, diminished T wave amplitude, Osborn waves, which are also known as J waves, various degrees of AV block, ST elevation in leads V1 and V2, sinus node dysfunction with possible tachybrady syndrome, as well as arrhythmias such as VTach, VFib, and torsades de pointes. Okay, so I want you to be aware of this J wave or Osborn wave that can also be seen in some other things. So this is our J wave, right where our J point is. Remember, our J point is the beginning of our ST segment, or comes right at the end of our QRS complex. So here's our QRS complex, okay? And it's this right here where our J point would be. We call that a J wave or Osborn wave, okay? And I want you to note that these Osborn or J waves can also be seen in hypothermia, early repolarization, as well as in Brugada syndrome. All right, let's review what we discussed before we end here. So we talked about hypercalcemia, meaning that we have an increase in serum calcium levels. Now we talked about a number of causes. The main ones are malignancies as well as primary hyperparathyroidism. Okay, and you can see a number of those listed here, other causes as well. In terms of EKG features, the main ones I want you to take away are the most common ones, okay, where we see a decrease in the QT interval, an increase in the QRS interval or duration, as well as bradycardia, so a slower rate of the rhythm. Some other rare features include an increase in the QRS amplitude, a decrease in the T wave amplitude, these Osborn or J waves that we saw here, okay? Again, not the most common ones, and remember those can also be seen in hypothermia, early repolarization, and Brugada syndrome. Other things that you may see that are rare are AV block, ST elevation in leads V1 and V2, sinus node dysfunction with possible tachybrady syndrome, arrhythmia such as VTach, VFib, and torsades. Well, that's the end of this lecture. We discussed hypercalcemia, including potential causes and EKG features. I hope you learned something.